This is Heather Bryant with Dr. Fasolino's adult clinical class, and I'm doing my case presentation. Mrs. Smith is a 41-year-old African American female who presents to the clinic today with complaints of copious nasal discharge as well as a headache. Her history of present illness include that she was sick with the flu approximately 10 days ago. She states that she thought she was improving after diagnosis, but then she began to worsen. She states now her worst complaint is thick green mucus from her nose that is significant in amount, as well as a severe frontal headache. She describes the headache as pressure in nature and states that it is much worse when she tries to bend over to pick something up or tie her shoe. She also states slight pressure in her ears bilaterally as well as a mild sore throat that is especially worse in the morning. She denies other complaints. For the review of some systems, the patient states that she has a frontal headache across her forehead only and no other part of her head. She states that the headache is pressure in nature and that it is worse with movement such as bending over. The patient denies photophobia or visual disturbances, and she states that she has significant nasal discharge that is green in nature from both nostrils. She also states mild pressure in her ears bilaterally, as well as mild sore throat that is worse in the morning. The patient denies any pain with movement to her neck. She also denies any tenderness to her neck. The patient also denies any cough, chest pain, or wheezing. She also denies any shortness of breath with exertion or abdominal pain, nausea, or vomiting or diarrhea. She also denies any urinary difficulties such as burning or increased frequency of urination. The patient also denies any neurological weakness. She states a general fatigue overall that she states hasn't improved since she got diagnosed with the flu, but no neurological changes or weakness. She also denies any rash or lesion on her skin. The patient's past medical history is negative except for a history of asthma when she was a child. She also states that she has had 2 C-sections and an appendectomy for surgeries. She denies any drug allergies, and she denies being on any daily medications or prescriptions. The patient also denies that she smokes. She states that she does not smoke and that she only drinks alcohol socially on special occasions. She also denies any drug use. The patient's last menstrual cycle was 2 weeks ago, which was on schedule and without abnormality. As far as the review of the physical exam goes, the patient's blood pressure is 124/82. Her heart rate was 84. Her temperature was 98.6 orally. Her pain score is a 6 in her head, just across the forehead. She also has a respiratory rate of 18. Her height is 5'7" and she is 165 pounds. Constitutionally, the patient is a cooperative and appropriate female who appears to be her stated age. She is well nourished and well hydrated. She is alert and oriented ×3. The patient's head is atraumatic and normocephalic. Her pupils are equal and reactive to light. The patient's nares does present with mild edema and erythema, although it is patent bilaterally. The nares also has copious purulent discharge. The patient's frontal sinus is also tended to palpation bilaterally. The tympanic membrane is well visualized bilaterally. There's mild cerumen noted. The bony prominences are clearly seen, and there is no bulging of the membrane noted. The patient has mild erythema in her oropharynx without exudate. The neck is supple without any indication of adenopathy. The patient's heart sounds are clear S1, S2 to auscultation without rubs, murmurs, or gallops. Her rate is regular and her rhythm is regular. The patient's lung sounds are clear and equal bilaterally to auscultation and percussion. It is clear in all lobes. The patient's abdomen is non-tender without signs of hepatosplenomegaly. The patient's extremities appear normal without any abnormality in strength. Her grasps are equal bilaterally. She has equal sensation bilaterally. She also has no edema or clubbing noted. Her skin appears without rash or lesion. The differential diagnosis for this patient could include things such as a migraine or a cluster headache, allergic rhinitis, or maybe an obstruction of her septum from a foreign body or a tumor. She could also have a dental abscess. The actual diagnosis for her exam is a frontal sinusitis. She will receive for her plan, her treatment plan, amoxicillin 500 milligrams 3 times a day for a 10-day course. She has no history of taking significant antibiotics, and she has not been on an antibiotic for a long time. So it is indicated that this antibiotic should work for her. She is also encouraged to take a pseudoephedrine product over the counter along with the amoxicillin to help with decongesting her sinuses. The max daily dose for that is 240 milligrams, and she's encouraged to follow the dosing instructions on the box for the particular product that she chooses. She's also encouraged to follow up in our clinic if she does not start to feel better after the 10-day course of antibiotics are completed, or if she starts to have worsening symptoms, or symptoms such as chest pain, cough, dizziness, or other concerning complaints. And that is the end. Thank you.